Good morning and welcome to my training on measurement-based care. I'm glad you can join us today and I hope you're enjoying your virtual training today. We're going to be talking about measurement-based care, which I see as a roadmap to better patient and provider outcomes. My name is Traci Bolander and I'll be your presenter today. A little bit about myself so you can understand the role that my journey has played in getting me to become passionate about measurement-based care. As you can see from sorry, I forgot to click the slide. As you can see from my background, measuring progress has always been part of what I do. I'm a retired teacher, a licensed psychologist who focused on assessment. I founded my own behavioral health practice, have spent my life cultivating culture and being an innovation champion. By the end of today's seminar, I hope that you have a brief understanding and can recognize and discuss the impact of current and future trends in healthcare, discuss the value of measurement-based care, and identify potential ways that you can use measurement-based care in your practice, no matter what it is, primary care or behavioral health. I think most of the folks in this audience are probably really familiar with why healthcare has to change. It is very well known that the U.S. ranks lowest for healthcare coordination and also has the worst health outcomes, but spends one of the highest amounts on healthcare. The other thing that we have come to discover is that if we're going to address these concerns effectively, we must address behavioral health care and start treating the entire patient. When we introduced the ACA, we knew that healthcare had to undergo some major transformation. The goal was to ensure that we could provide the best care and improve the individual experience at the best cost for the whole population and improve the health outcomes for our entire nation. We knew that in order to do this, we had to add another aim. We also needed to ensure that our healthcare providers felt valued and felt like they could provide the quality care that they needed. So we knew that the healthcare system transformation had to shift to a patient-centered focus. In this patient-centered focus, the patient's at the center with all the things involved in their healthcare surrounding them: the health system, individual providers, technology, and communication with the provider. We shifted from a healthcare model where the clinician, physician, provider was the expert and really focused on a tell me what's wrong, tell me what to do, to a collaborative model where the clinician and the physician were all about teach me and be my partner in this care. We all know that addressing behavioral health is very important to address the whole being and treat all aspects of a person's health. We know that it's a very prominent problem with almost 1 in 5 Americans experiencing mental health issues, with a large portion of the population that has mental health disorders having more than one, as well as having the comorbidity with other health disorders. Another main cost that mental health plays in our system, beyond the healthcare system, is it is it's one of the leading causes of disability. So it's obviously very critical to talk about mental health and how that affects overall healthcare, or else you wouldn't be here today listening to this training. Mental health up to this time has sort of been somewhat elusive. It was sort of the magic that happened behind the closed doors with a psychiatrist or with a therapist. But what we have come to learn is that it's really no different than any other healthcare. And we have to treat it the same. When I think about how I am treated by my physician, if I were to have a chronic medical condition like high blood pressure, my expectation would be that the physician or the provider providing care for me would use something to measure how I am doing. They might take my blood pressure, do some blood work, but when we think about behavioral health of the past, We often thought of a therapist sitting on a couch, much like this woman is with her patient, and starting a session by, how are you feeling today? So very heavily reliant on a subjective report. We would not do that with physical health. And so we have now learned that it is much more beneficial to not rely on it for behavioral health as well. When we look at this little chart, we can see how those things can correlate. For example, if I am a physician working with a patient as their collaborative partner on their diabetes, the first thing I'm going to do is I'm going to measure, how are they doing? What are your insulin levels? What is your blood work telling me? What's your A1C? And then I'm going to determine my treatment method. I might say, you need some insulin. We're going to work on changing your diet, or I might treat them with medications. The same for heart disease. How we now approach behavioral health is much in the same way. For example, with anxiety and depression, instead of just relying on the patient's self-report of how are you feeling today, we got a little better early in my career. I learned to say things like, on a scale of 1 to 10, where would you rate your depression? So at least I could quantify it. Fortunately for me, measurement-based care has come a long way since my 1 to 10 self-rating scale of your depression level or anxiety level. Now we have instruments we can use which actually help us more objectively measure how a patient is doing. It allows us to get information that we might not otherwise get. And from that, make decisions about what would be my best next step. It's almost always an evidence-based treatment. One example might be CBT. I might choose to go the integrated care route where I'm treating that patient in primary care, no need to come to specialty care. I might teach some mindfulness activities or engage them with medication care. So what is measurement-based care as it relates to behavioral health? It's an objective measure to track treatment and its impact. We started off, as I said, by saying reporting your depression level every day, every week when you come into me for therapy. And my goal was to get you to stop reporting that you were at a depression level of 10 and bring that down each week. The same works with measurement-based care. However, I'm not solely reliant on that ambiguous 1 to 10 scale. And I'm going to collect it on a routine basis. In my practice, we are collecting it every time we see the patient, minimally once every 30 days. And we're going to monitor their progress towards a desired outcome. Our goal will be to decrease your PHQ-9, which is a very standard measurement scale used both in primary care and in specialty behavioral health settings to measure depression. We're going to work to get that score down for you. And we use that data to inform our treatment goals and objectives, to change the level of care that we're giving, and to justify that we are making progress. There's lots of benefits for using measurement-based care for patients. It increases patient engagement. By involving the patient, not just in the session, but also outside of the session, in paying attention to their symptoms, research shows us they are much more likely to get better more quickly. It also improves treatment effectiveness and efficacy. Not only can I, as their provider, guide their treatment, but they, as the patient, can also choose to engage in activities based on the level of distress that they are feeling or reporting on a objective measure. It also increases patient knowledge. So it isn't just me as the expert telling them what's going on, it's them actually seeing what's going on for them and being able to look at specific symptoms that are causing their level of distress. Additionally, there's lots of benefits for providers. It gives me a very clear focus for my treatment and also gives both the patient and I early feedback on symptoms. It's not atypical for a patient to come in and sit down with me after filling out a PHQ-9. And if I were to start the session by saying, "How are you feeling today?" they say, "I feel fine." I look at their PHQ-9 score and note that they're actually scoring in the severe range. And I'm able to have a very focused discussion on that with them about their sleep or their sadness and how that is very different from the self-report of feeling fine. I've actually had patients say to me, "This is my fine." And so it really does instill a lot of hope both in them and me to be able to say, this is not how it has to be. And let's pick one of these symptoms that you said is bothering you. Your sleep. What if we just were to focus on sleep this week? Do you think that would help you feel better? Without a doubt, I always get a resounding yes. And then we can really focus on treatment on a very specific symptom and give them feedback on that symptom. Because next week when they come in and try the sleep methods that I told them, we are able to objectively assess whether that worked or not by looking at that sleep score. Did it improve? Did it not? What do we need to adjust? So just doing no screen time before bed did not work for you. What do we need to do differently? So instead of waiting 4 weeks for us to decide to change our treatment course, we can adjust as we go on the fly. You've heard me talk a lot about the patient health questionnaire, the PHQ-9. One of the reasons why the PHQ-9 is so widely used is it's quick and easy to administer. It's got good psychometrics behind it. And you can see from the screen, it can give me very specific treatment areas to focus on. I mentioned the sleep. You can also see that it has things like difficulty falling or poor appetite, overeating, not feeling good about yourself. At the bottom of the screen, you also see the GAD-7, which is another commonly used instrument to monitor anxiety symptoms. In my practice, remember I said this was going to be a roadmap, so I'm going to tell you how I did it, so perhaps you might learn something that you could apply to your own practice there. When we started in our practice, we used the patient health questionnaire and the generalized anxiety disorder scale with all our patients. They filled it out on paper every time they came in. This was a step in the right direction, but certainly difficult to manage when we were seeing about 250 patients a day. Wasted a lot of paper. It was hard to track a patient's progress. So as a practice, what we chose to do was engage technology. One of the things that COVID has taught us is that technology really does enhance our practice and give us an opportunity to connect with patients both in session and outside of sessions in ways we couldn't, as well as streamline our measurement-based care. So we moved from paper to a measurement-based care technology app that has helped us look at our patients in a different way and get to our information much more quickly and efficiently. So for example, this is not our patient, but if we were to look at Sam might be a patient in a primary care office who they were seeing for hypertension, who they were using NeuroFlow with, and they were doing PHQ-9 screens on a regular basis. You can see in November, he scored in the low range. He's creeping up in December, as some of us might when our stress increases during the holidays. And by January, his PHQ-9 score was in the moderate range. This would trigger that there might be something going on for depression for Sam. So we would assign him define him as an at-risk patient, ensure that he was doing on the PHQ-9 on a regular basis, and then also give him some activities to do. One of the things we like about using a technology app to do this is it's more than just giving them the PHQ-9. I can also give them activities to do to enhance their treatment outside of my session, and I can track what they're doing, and they can see their progress as well, because we know that research shows us if a patient sees that my PHQ-9 score is going down, they are much more likely to continue to engage. They also receive some rewards and incentives for completing the activities, and there's lots of things they can choose to do on their own. As a psychologist, I am very interested in data and proving that things are working. So we entered into a little study with our practice and those that were using our measurement-based care system to see how was it really improving their care. And we did find a correlation between validated assessment scores and engagement in care. The other thing that we saw a statistically significant statistical significance with is that folks that were highly engaged with the apps, they were doing their questionnaires on a regular basis, they were doing activities, had greater symptom reduction than those that were not. So we see these as promising results and are excited to continue to measure care in our practice and teach patients how to be our treatment partner by measuring their own care. So now that I've sort of given you this very brief overview of measurement-based care, what are my hopes? My hopes are that, number one, you're excited to be a patient's treatment partner. You are interested in talking very specifically about symptoms as it relates to behavioral health. Not just, are you feeling sad? Are you feeling depressed? But what are the specific symptoms that you're experiencing, such as low mood, lack of motivation, difficulty sleeping, and attack those symptoms head on with evidence-based treatments, measure the progress, and course correct as needed because you're watching what's going on and is it working or not. And then it also gives you the opportunity to instill hope in patients and in yourself as you start to see that success with your patients. And my wish for you is that you take the time to celebrate each success, no matter how small. I hope you're excited about learning more about measurement-based care. Obviously, in 20 minutes, we can't do much, but this conference is a step in the right direction to give you the opportunity to learn not just what I'm saying about measurement-based care and using technology during COVID and beyond, but also how to use measurement-based care as an adjunct to your practice to help you thrive in this new normal. If you're interested in what I talked about, you're welcome to reach out to me. My contact information is on this slide. If you're interested in learning more about the technology that we have used to help us succeed in this measurement-based care world, I believe that NeuroFlow is actually a displayer, however you display in a virtual conference, at this training, and I would encourage you to virtually stop by their booth and talk to them. Thanks for listening. I look forward to hearing more from you.